we've kind of heard from our own people at CFI how they've been dealing with the disease. Not everybody looks at this the same way. Some of our compatriots in the United States have, like I said, they've got different programs, different ways of looking at it. This morning we were going to take a little bit of a look into how the state of Wisconsin deals with CWD and maybe get some similarities or differences to what we're doing here. Anyway, it gives me a great deal of pleasure this morning to bring Dr. Amy Horn-Delzer, who is the manager of farm deer and CWD programs. I got that correct? Very good. And she's going to give us a presentation, as I said, on how the state of Wisconsin deals with it. I had to give her. I keep having to give her a little plug all the time because one of the things that we have in common with with people in Wisconsin is that the Wisconsin people now have the Alsager family to contend with, and so it's been a little bit of a topic of conversation. So I guess you can, if you have any questions about that, you can ask her how she's dealing with it.
Well, thank you for that introduction, and just to start off, not only am I not Randy Pritchard, and not only am I not speaking about the USDA, but Harvey also gave me 2 hours to speak, so you're going to miss your lunch today. So we're going to cover a little bit, and I'm going to gloss over a lot of this, partially because you've already heard parallels in your own system and so forth. So bear with me as I'm going to really scoot through part of it very, very quickly, so we don't have repetition, but I'd like to give you a little bit of history on how our program was developed there in Wisconsin, where we stand today, what our regulations are today, and throughout, I'd like to touch a little bit on the cooperation that we get from our agency, which is Department of Ag, Trade, and Consumer Protection, the DNR, which is, of course, our natural resources, as well as our stakeholders in the public. So, early on in the 90s, the Department of Natural Resources had all legislative authority over all farm deer. DATCAP had the authority over health concerns in the deer population, as well as other animals, of course, but the DNR actually held the legislative authority over it. In 1995, DATCAP did obtain the authority over commercial deer, that everything except the white-tailed deer. DNR did retain that authority. Along with the authority comes the licensing piece of it, the health piece of it, and all the other maintenance that goes along with maintaining that. 1998, our pilot CWD program was developed, and I just want to mention the initial pilot program, which was a voluntary program, the discussions on that was initiated from our elk industry in Wisconsin. There have been other things going on, of course, at that time that we've heard this morning in Colorado and some of the other places with elk, and this industry was forthcoming and coming forward to the DATCAP and asking for some regulation, and part of it was so export markets could be kept open. But this was the initial pilot program. A lot of the things we see in the pilot program here, I'm not going to go through and read them all, are very similar to the USDA program and what a lot of states use today in their voluntary CWD programs. Nothing really new on that one. 2001, the first touch of Wisconsin CWD was it was part of a large trace out from elk herd that was distributed from Colorado that was positive and distributed to several states. Wisconsin did not end up. We culled those elk, they were tested, none of them were positive in Wisconsin. In 2002, these rules of the voluntary program started to become part of our laws, and legislature was looking at these and so forth. In the meanwhile, it hits in yellow. Wisconsin was diagnosed in February of 2002 from the 2001 hunting season with CWD in the wild. This was in Dane County, and I'll show you some maps later because it does relate how we handle things today as far as the location of where this was. which moved things ahead a little bit faster with the whole legislation and regulatory piece. The early days, DATCAP quarantined anything that was in those, they called them endemic zones, and again, I'll touch on this a little bit later, it'll be a little clearer to you. And those farm deer in those areas were actually depopulated. 2002, the regulations that we're talking about with the voluntary program, those were put into an emergency rule to get them through. And the first formal interagency team was formed upon diagnosis of those wilds, and it was formed from DNR, DATCAP, and Public Health. They wrote the initial CWD response plan that touched both on captive deer as well as the response in the wild. One of the recommendations, of course, these are only recommendations, and there's a lot of other factors, as you all know, that goes into legislation. But one of the regulations was a statewide baiting and feeding ban. And I mention that because it's one of our most highly controversial pieces that are out there as far as regulating things in the wild. And this is just a funny part of it, because we laugh about, if we get calls on anything, more than anything, it's the complaints that the DNR puts on feeding and baiting bans in the wild when we get a new positive in the state. This team also had input on how we formed that emergency rule at DATCAP. The emergency rule, all imports needed 5 years of surveillance on that. Mandatory CWD testing initially, Wisconsin had 16 months of age and older. That was taken out of a lot of the early research, which was from elk. So anything going to slaughter had to at that time. Carcasses leaving the premises as hunting ranches and so forth were part of that. No one could move deer in Wisconsin with these early rules unless they were part of the voluntary monitoring program. And monitored herds, again, had a few of the recommendations that we do see today as well. June of 2002, the National CWD Plan, the USDA got together and we're discussing the national plan as well. This fall, in the fall of 2002 then, here we have our first captive positive in Wisconsin. Right after that, the DNR had the DNR captive wildlife law there, which gave DATCAP, the Division of Animal Health, gave us regulatory authority over all commercial deer, including the whitetail. They do, however, to this day retain fencing authority for whitetail deer, and you'll see a little bit later on how our agencies share information in those regards. This also gave, putting all the deer industry, the captive deer industry, into DATCAP. We were allowed to call them all livestock. Calling all of our cervid farming livestock made them eligible for state indemnification. So the rules, the rules became permanent in 2003, and similar to what we've seen before, I'm not going to go through all of that again. We did include markets, dealers, truckers in those regulations. Anybody who handles cervids are part of that. And our standards for CWD collection, we did have standards in there as well. At that particular time, early on, there was USDA funding for testing, not the sampling itself, but for testing. And so part of this really does parallel what has happened in Saskatchewan. And I was writing furiously and saying, wow, that's what's happening in Wisconsin. So we've got two scenarios here again, with the disease itself and with the regulation of it. Prior to 2015, all CWD infected herds were depopulated. Depending on when these deer moved out of the source herds, some of those were depopulated as well. All trace out exposed animals were depopulated and tested for CWD. Those early years as well, handling those, there was federal funding for it, not only for the CWD testing. There was also funds available for grant money for double fencing, for official identification, and then of course federal indemnity. So our early days here, this map was from 2007, but the first positives were in this area. The next year, 2000, let's see, it was 2002, they expanded a little bit here. 2003 brought on a new area of positive endemics. In these endemic zones, the early response was to quarantine first, depopulate those farm cervids that were in that area. Anybody that was in what they call the monitored zone, those herds were quarantined and they were mandatorily required to be part of our voluntary, it wasn't voluntary anymore, it was mandatory. If they were going to continue farming and not be depopulated, they had to be part of the CWD program. These are our early CWD positives. And you see, you'll notice, surprisingly not, they correspond to the area of where we see the CWD in the wild more so. The numbers refer to how many CWD positive animals were in there. This was actually our first diagnosed CWD positive. And again, like in Saskatchewan, this actually was a delayed depopulation. It was first discovered and there was a delay as it went through the litigation and through the court system. And these are whitetail here that we're talking about. This farm, when it finally was depopulated, had 80% prevalence in it. I'm just going to flip over here once. This is a complicated slide, but what I want to pull out, this is our first farm, and of course we've seen these arrows in the tracing, trace outs and source herd tracings. This is how it was handled. These were depopulated, of course, the source herds. It tells a little bit about testing here, but interestingly enough, the early deer farming in Wisconsin, whether they were ranches or breeding farms, were formed. You'd put up a fence, a high fence, DNR would come in, assess the number of deer. You could purchase those deer from the DNR. Surprisingly enough, we've got CWD in this area in our captive cervids. The other thing is here, this farm, notoriously, the deer farmer early on, the DNR would drop off orphan fawns for rehabilitation. They became part of his farm. Surprisingly enough, that's where we get infection here. And then again, in the trace out herds, those early deer were culled and tested. And I just come back to this, I wanted to point out our one early positive elk herd. That herd was, the one elk that was positive was an import from Minnesota, from a Minnesota positive herd. And it's the only elk herd that has been positive in the state of Wisconsin. So our early history here, we had, actually this elk herd was in the process of being investigated because it had a TB suspect. The cow that was tested and positive for CWD happened before the retest could take place, so this herd was of course depopulated. We had 14 herds completely depopulated. 3 herds of trace animals were removed and tested, and then later on here we had 2 additional positive herds. So 9 captive positive herds in the early days, the first 6 years. So where do we stand today? And I have to brag a little. This is this hunting season, and these are 2 of my children. It was a successful hunt. CWD in the wild. Of course, we have our epicenters where CWD started. Echoing a little bit of that, as you see the Wisconsin River come up. The Wisconsin River actually goes further than what this map shows. We're having positives here as well. This is an outlier. This was diagnosed in 2011. And there has been extensive testing in this area. No further CWD has been found at this time. We have 19 of the 72 counties affected with positives in them. 43 counties are in the CWD affected area. And you notice the blue shadows, those are the counties that are in the CWD affected areas. A CWD affected area is a DNR designation, and there's a few things that hinge upon that. One is the baiting and feeding ban, so you can see how extensive that is in the state of Wisconsin. Another are some of the rules that we have as far as escapes and how those escapes are handled. So the way those are designated is if there is CWD in either wild or a captive deer, they become part of the CWD management or affected area, or if it's within 10 miles of the county line. So that's why we see definitely more counties than positives. You see the testing that has been done. You see the total positive. These are wild, in our wild population. All of them white-tailed deer. We have not had elk test positive, although we are at this time, DNR at this time is importing elk and getting 2 small herds started. Hunters may have wild deer tested at no cost to them. And there is a pilot program that they are starting as well. The numbers, we have targeted testing. CWD across the state of Wisconsin in the wild runs about 7%. And I hate to throw that figure out because it's a very skewed testing population. So that 7% it sounds very, very high. But the majority of the targeted testing, similarly to what we heard earlier this morning, is headed towards sick deer reports. It's the majority of our hunter population, but they give incentives to test in areas that they really want the high testing numbers. So, for example, for many years this was a very high targeted area of test. They test very extensively around the perimeter to see how far some of these areas have spread. They're testing, and you'll see when I pull up the map of where our captive positives are, they're upping the testing in those areas as well, of course. So it's a little bit skewed. But they started so they can reach their targeted numbers because they have trouble getting enough hunters to submit heads. They have an incentive program that they started testing where the hunters can actually just sample their own and send them in, and the DNR wild deer are tested surveillance through ELISA through our state lab. Captive buried deer, what are we talking about in Wisconsin? We have, and I apologize, we are just through our licensing cycle now, so this is actually last year's data. We have close to 400 registered deer farms. Believe it or not, despite what the CWD problems and the political pressures, we still have new farms forming, and about half of those are in the voluntary CWD program. And I don't know if you can see from the back, this is just a trend of deer farms, parallel to what you've seen here. The total deer farms continue to, this is the total is in gray, continue to decline. These are those that are enrolled in the herd status program, again, continuing to decline. The non-enrolled ones are in light green here. You see a little bump here. That's because of some of the regulatory things that have happened in 2005. USDA program standards gave until 2015 to comply with certain standards. Some of those were very, very difficult for the small herds who didn't have capabilities to handle deer, some of the ID requirements and so forth. That's why we saw some of the some of the program deer non-enrolling. And then our hunt ranches stay relatively stable. We've got around 60 of them in Wisconsin. And these are deer numbers. Again, this is white-tailed deer in the gray bars. Numbers are going up just a little bit in our white-tailed population. Our elk in red is staying relatively stable. Our other deer, part of the program, Wisconsin's program is broadly over all cervids. So reindeer is included, elk, muntjac, sika, fallow. We've got some, we do have no mule deer in the state, but those are all included in the program. So how our standards look today, how our rules look today, if you want to become a deer farmer in Wisconsin, you have white-tailed deer, you do have to obtain a fencing permit for white-tailed deer. You have to have a half-acre minimum. You have to have a Wisconsin premises ID number, and that is for all livestock and poultry. We use that for disease, in case there's a disease outbreak. We want every premises that has livestock registered with us. There is an Amish population, a couple of them in Wisconsin, who through the courts do not have to register their premise. premises. However, we handle that by, they have to fill out paperwork to be exempt from this. And on that paperwork, we ask similar questions as where you live and what livestock you have. So that's how we got around that. Beautiful. Registration happens yearly with our agency. One registrant may have multiple locations. They have to have the same status. However, they have to both locations have to be either on the CWD enrollment program or non-enrolled. And of course, the herd records. Some of the rules, and again, I'm going to gloss over these quickly. There are fees with our enrollment. You can see it's based upon whether you are part of the voluntary herd status program or non-enrolled herds. Our hunting ranch certificates also comes with fees. And our hunting preserves do need at least 80 acres to hold hunts, to sell hunts on their land. And again, anybody can ask me later if you have questions on these. I'm glossing over them very quickly. Our herd status programs, minimum 5 years of status in order to move any live deer off your place. Of course, TB tuberculosis status. Any movement off of there has to be followed with a CVI, Certificate of Veterinary Inspection. And again, in 2015, 2 forms of ID are required, one of them being official. Our non-enrolled herds can move only directly to slaughter with proper paperwork unless they have a second location. If you have a breeding farm and a hunting ranch, you can move in if both of those are enrolled, registered as similar locations. All you need is 2 IDs on that and proper record keeping so we know where those deer are. Because these guys in the non-enrolled herds do not have to fill out an annual census, the numbers and so forth that we have on those are soft, they're self-reported, but of course in some of the hunting ranches that's to be expected. And of course hunting ranches can only move carcasses off of their premises. Some of the testing requirements, 12 months of age and older, we saw that drop with the USDA standards coming, so Wisconsin's rules followed suit. 100% of all deaths are intentional culls in these herds. This was just recently, industry came to us and said, we've been testing these animals ad nauseum for a long time, it's an expensive thing, can we drop it? So we did just this year in October, the rule dropped that if you have less than 5 years of a status, you still have to test anything going live to a slaughtering establishment at 100%. If you have 5 or more years of status, however, that can be dropped to 25%. Now that's only to slaughter USDA inspected slaughter establishments. The non-enrolled herds, we still require 16 months of age on those. 50% of those killed intentionally, and that's with exception because if you do have a breeding farm that is CWD enrolled, we require 100% of those deer to be tested in your ranch. 100% of accidental natural death, whose remains are testable. This is also something that industry wanted to be put in rules because they were being punished for the spring thaws when you find deer that are untestable and destroyed and chewed up by predators by that time. And again, the 25% of deer shipped live to slaughter would only pertain to those farms that are not hunting ranches. Here are our test numbers. Voluntary program here, voluntary testing first. Then once CWD hit, we had mandatory testing for all herds. You see a little bouncing around here, and these are some of the latest test numbers. Over the course of some of this, our federal funding came away right there. So the entire cost of testing now falls on our producers, testing and sampling. And so in response to that federal funding running out in 2012 was when we changed rules to drop some of those testing requirements, the percentages of animals testing. What happens if you miss tests? In our herd status herds, if you get less than 90% of tests on a census year, you are suspended. Suspended herds cannot move animals, live animals, off of their property. You have the choice at that point. You can call to make up for your missed tests, or you can stay on suspension for a year, of which we analyze again. If you get over 95% on this next census, then you are allowed to go ahead. The suspension is released. You can go ahead and move animals again. In our non-enrolled herds, It's only documented, they do have to document those missed herds and in the ranches and so forth. If they aren't testing properly, they can be met with compliance action, or we can actually put a conditional license on them. Our requirements for sampling, we do allow our licensed federally accredited veterinarians, of course, they go through a short course and are certified to sample. We also do allow our employees of our farm operations or an owner to test if they go through proper certification. They can only test for their own herd or from the herd that they're employed. If the employee travels to a different herd and is employed there as well, they have to go through training again. All samples need to be submitted through an accredited licensed veterinarian, however. And the timeline, we had heard this morning a little bit about hanging on to samples and so forth. Our rules do incorporate a timeline. They have 7 days to test a deer after death. The herd owners have 2 days to get that sample to an accredited veterinarian. The veterinarians have a 10-day turnaround to get that to the lab because we don't want pooled samples. And then again, sampling fees paid by the owner. Other requirements of our voluntary herd status program, you can get the status, just like TB and brucellosis, from the herd that you purchase animals from. 2 IDs, we already went over that. A lot of these are the USDA standards that we see. This was in 2015. They also had to have a physical herd inventory submitted by the herd veterinarian every 3 years. Just gives credibility to those census. And going through and reconciling with those physical inventories, we definitely found herds that just turned their paperwork over. And when the physical inventory had to come in and the veterinarian had to confirm those ear tags, and they usually do that, they coincide that with their TB testing, some of those were a nightmare to reconcile. So keeping everyone honest there. And escapes. I mentioned escapes before. Cervid farmers, you know, no matter how good your fencing is, we have trees, we have vandalism and gates left open. It is not a violation in Wisconsin for your deer to escape. It is a violation not to report the escapes. They have to be reported both to our agency and to the DNR. Herd owners are responsible for cleaning up the nest. They are responsible for either taking the deer off the landscape or getting them back into their own fences. In deer that are returned, in this piece, if they're returned in less than 120 hours, no herd status is lost. Again, that was upon industry request, only in the counties that are not CWD affected areas. So they are given a few days to get those deer back. If they are in a CWD affected area, they're 24 hours to get it back. And then interagency here, when there is an escape, DNR is notified, we're notified, they're communicating with us to assess the risk level. Is it a herd that is CWD enrolled? Have they been in good standing? How many have they tested? How many years has the herd been there? And so forth, to determine the risk to the wild population. It will, again, the herd owner is responsible, but the DNR assesses the risk and they will be involved if they deem appropriate risk. Another area where we work together, if your herd falls in an area where there are 2 positives within 5 miles, your herd is quarantined. And so we do get data, we do share data back and forth to get the list of, and this map is a little bit complicated, but this is how we map out the small dots being wild positives, the larger dots being our cervid farms in these areas. You're quarantined if 2 positives come within 5 miles of your farm. If you are double fenced, you're not quarantined and you can maintain your status. If you're notified, you have 90 days to double fence before you will start to lose your status. Status starts over then. And there is no, at this time, no cost sharing for double fencing. So folks ask, how do you know that folks are being honest? How do you know that deer farmers are being honest and we're getting good data? Of course, our annual census and physical inventory reconciliation. We do have animal health inspectors on the ground inspecting both our enrolled and our non-enrolled herds. Every 5 years for our enrolled, every 3 years for our non-enrolled. Our hunting preserves fall within this category, so our animal health inspectors go and inspect records. They inspect those hunt records and the testing records and so forth to see that they're fulfilling their obligation. And of course, our animal health inspectors are also out there anytime there's an investigation, traces, quarantines, things such as that. What do we do about it? First off, our job is to educate. Warning notice, civil forfeiture. If folks are not willing to follow the rules, they can lose their status, of course. We can also take legal action with the district attorney. So where are we with our positive and our farm-raised deer? 15 herds since 2001 have been positive for CWD in Wisconsin. 11 of those herds, 11 herds have been depopulated, so we do have 4 herds on the ground now, which are managed a little bit differently than the early days. We've had 182 CWD positive farm deer, and we've had over 44,000 tests recorded in our records. There are more than that. We don't always get the data from outside labs. If they're tested in Minnesota or Colorado, we don't always get that data for the negative tests in our agency. And again, a lot like Saskatchewan's data, here are early positives. These are numbers. These are herd numbers. These are deer numbers. These are our early ones, and we enjoyed almost 5 years. We thought we had it licked, of CWD-free in our captive deer population. Now we're starting to see it again. So the reasons for this, and similarly from what we heard earlier today, a lot of these are traces. A lot of them you can trace the selling and buying pattern of those deer for those early positives. These are popping up. And it's not always clear, most of the time it's not clear on some of these later deer positives where they came from. Food source, and you'll see when I show a map, some of these are in areas where they have not found it endemically in the wild population yet. And again, these are acting differently as well. Some of these, half of these latest herds have been in the CWD herd status program, so they have been testing all along. The one breeding farm that was diagnosed and depopulated in 2015 had been testing, I believe, since 2003. All of a sudden in June of 2015, we found our first index animal positive. They were depopulated in November, and out of 170 some animals tested, there were 34 positives already. So that's just a real quick blossoming of CWD in a herd like that. That herd was right here, depopulated. CWD had not been found in the wild in any of these counties surrounding. So that's that. This map is all of our deer farmers, active deer farmers at this time, in the yellow dots here. The red dots are where our depopulations of positive herds have happened. In the stars here now, these are the ones that we have just lately that are continuing to do business. And I said we are handling these a little bit differently than we had in the past. This is a 2015 non-enrolled herd, small herd. They had been on quarantine because, as you notice, they're in the endemic area there. 2 positives within 5 miles, so they've been quarantined since the start of that herd. It's a very small exhibition herd, you call it, a petting zoo type. They sell pumpkins and so forth. But 9 deer on that herd, testing for a long time, 100% testing on that herd, all of a sudden comes back positive. But it's in the endemic area. Their hay source is outside of the fence, so it's not surprising. Those deer aren't moving anywhere anyway. It's for the public to look at. He's continuing to do business. Another 2000, this is actually a 2013 hunting ranch that was diagnosed. He owns 4, actually partial in another one, but 4 of his herds are right in this area, to breeding farms, to hunting ranches. The index animals, and actually the first few animals found in that herd, traced back into his breeding farm, and that was in 2013. He's continuing to have positives out of that preserve. In 2016 now, I believe he had 25 in all over the last 3 years. He had 12 of those come positive in his hunts this fall. None, although they trace back into his breeding farm, there have not been in this period of time. His breeding farms are quarantined as well. None of those deer have shown to be positive, nor any of the deer traced out from those breeding farms that were exposed. This one up here, Oneida County, no CWD positives in the wild in any of these counties up here. All of a sudden we come with a 900-acre hunting ranch that had been a hunting ranch since the 90s. Had been testing all along, not holding a huge amount of tests, but we do have test data history there. New owner in 2014, 2015 comes positive with their first CWD2. In 2015, this past year, had another 6 out of that herd. Estimated population of about 500 deer in that one. He's continuing to do business. We put stipulations on these hunting ranches, but everything leaves dead, so we feel the risk is low of passing CWD on. You can imagine, though, the public outcry of folks when a hunting ranch in an area that they consider pristine for CWD is allowed to do business. And that's where we get a lot of the phone calls from, as well as all the little backyard deer lovers and hunters who can't bait and feed anymore as well. This is our latest one, hunting ranch here in Oconto County. Menominee and Oconto counties were not in the CWD affected areas before. This, and there's no wild in Shawano County either. So no endemic wild population. However, the testing in those counties, because of the targeted testing since 2006, I think I counted up 20-some animals tested before 2016 in Oconto County, so not found in the wild as of yet. That's a large hunting ranch. It's about 1,400 acres, and I just looked on his last licensing, about 1,800 animals is what he's declaring on that. They are continuing to do business as well at this time. So a positive, immediate quarantine, of course, no animals on or off of premises. DNR is notified, they look at the fences. Quarantines on any traceback farms until we can discover how the time period that the deer left that traceback farm and entered the positive farm. We look at exposure periods, typical epi on where those deer have moved. On a positive herd, then a herd plan is developed. The herd plan contains information on the stipulations put on them as far as what we say, what falls within our jurisdiction of preventing any disease from escaping and moving out of the fence, as well as cleaning, disinfection, indemnity if they choose depopulation, and time periods put on that. Our current rules are those properties, even upon depopulation, are fenced for at least 5 years. No cervids within the parameters of the fence then. And I don't know if any of the positive herds that we've depopulated in the past that actually contain cervid at this time. In fact, that one that had 80% prevalence, our first one, the DNR purchased that property and is maintaining the fences on there even today. Our investigations here, and you guys probably know a lot of how this is handled. If we have a positive in our breeding farm, of course we look at our source herds, where those deer had come from. If the positive was a natural addition, we don't have to go too far to look because these are not affected, our source herds aren't affected. Any trace outs are not depopulated today, they're not culled and tested. They're simply quarantined, and the herds are not quarantined, it's the individual deer that we quarantine in these trace out herds. If the positive deer did come from another farm or the source herd, we look at this time period here to determine what we're going to do with that herd. Of course, if it's a very recent move, the traceback farm would be quarantined as well. But even if it's a move that had happened within the past 5 years, we look at exposures here, and of course trace those out, and any deer that have been sold since then, again, individual deer are quarantined, as well as cooperating with other states. If exposed deer have moved across state lines, we notify other states. Changing gears to a ranch, and this is how we're handling these last few positive ranches. Of course, anything leaving, the trophies here, anything leaving is dead, so we figure very, very low risk on the exposure part of things. And the investigation happens very similarly, and I just want to give you an example on how 2 of our ranches have breeding farms where the positive deer in the preserve have traced back into their breeding farms, and they're handling their business portion of it very, very differently. They're working with us in different manners. The one breeding ranch that had a positive, had a trace back, that was the 2013 one, he has chosen to maintain the quarantine on his breeding ranch, but stop moving animals into his hunting preserve. Because of that, the last trace backs that we are going to have positives in that herd, his last movement was 2013. So coming on 2018, and to this date, we have no positives in his breeding ranch. 2018, the quarantines can be lifted, and he can resume business out of that, out of his breeding farm to move deer and sell deer. Very differently, the one that we've just diagnosed with the positive CWD in 2016, his hunting ranch, we had traced back into his breeding farm, and he is choosing, instead of shutting down movement into his ranch, he didn't think he could maintain his ranch numbers with only natural additions. He has chose to combine his breeding farm and his hunting ranch. So, so there is no chance of him ever coming off of his quarantine and moving animals again to other farms. What goes into developing a herd plan here in Wisconsin? Whatever it takes to not allow Prion to move out of the farm. We try to look at whatever risk there is, work with the farmers so that risk is as minimal as we can. Assess the risk to the environment or wild deer. We are handling things different if there is not an endemic CWD problem. Take, for instance, the exhibition farm that continued to business versus the breeding farm in Eau Claire County that was depopulated. We don't want any trace out or trace backs. I mentioned that not only deer moving out of the quarantined herd is limited, we also don't allow deer to move into those quarantined herds that are positive, simply so we don't put other deer farmers at risk. And then if the above are satisfied, we look at their business plan and say, what's going to work for you? Disease knows no boundaries, we all know that. States cooperate in the inter-cervid movement. The importing process, anybody who is importing a deer in has to be part of this the TB and brucellosis programs. We all have to follow the CWD program standards. We communicate with each other on our importing process. There are ways also that the USDA coordinates notification of the states and communication of the states on tracebacks. We talk to each other, we email each other, and there's a coordinated effort to share information and to work together amongst the states, and the USDA does coordinate that with monthly herd health survey calls and conferences, and all the states have to submit reports to USDA annually. DNR, DATCAP and DNR have an MOU together, and it involves a lot of information sharing. There's policies and rules that we feed off of each other. For example, in 2015, I mentioned the USDA standard was difficult to comply, so some of the herds became non-enrolled, DNR had a rule in place at that time. If you had white-tailed deer, you either had to be double fenced or you had to be enrolled in the CWD program. When some of these smaller herds couldn't comply with those USDA standards, DNR looked at their rules, put an emergency rule in place to drop their standards of either double fencing or being part of the program, which allowed some of these herds, which really didn't need, they weren't moving deer anyway, they didn't need to be on the program, but that's the cooperation that we do see in our agencies. Disease reporting to each other, both ways on captive and wild. Any large exposures, we notify them, we work together on escapes, the fencing certificates. And the other piece is not, it's not written. Their wardens are extremely helpful at being eyes and ears for us. They care about their wild deer population, of course, so if there's anything amiss, they have 170 wardens on the ground. We have 10 animal health inspectors. So we do get reports from them if something is wrong. This is another example of the agencies working together. Just lately we reviewed our CWD response plan, and this is a plan for both captive and wild deer that goes through the DNR board. It's recommendation only again. But you see, there's a lot of people here involved in this committee. It was a collaborative effort for the wildlife, the captive regulatory agencies, the health services, there's some rehabbers in there, a lot of hunting organizations, as well as our labs and vet associations. And I don't expect you to read this or anything, just to make a note that we had public comments at each meeting. We sent out the drafts to our CDACs, we call them, County Deer Advisory Councils. These are a voted member of every county has one. They give recommendations to the DNR on the wild deer population, what they would like to see, where things go. They had public input as well at each of their meetings. We voted to prioritize the actions, and keep in mind as we glance over these, they don't represent the consensus of all of us. You're never going to get all of those agencies in the room to agree upon anything, but it was a collaborative effort. In the end, we voted on them, and of course you see some of them are real obvious, some not, and these are some of the objectives that we had. My program associate wanted me to, her son-in-law was out at, he hauls grain, and so she's wondering if that's actually a violation of a baiting and feeding ban. That is a wild whitetail in a shed feeding off of a pile of corn to be sold. So then you look at that, and this is an endemic area. You wonder why CWD ends up sometimes in places that we don't expect it. And we also had a lot of questions about predators. This is a DNR study, so I can't tell you a whole lot about it, other than it is quite a large longitudinal study that the DNR has started in comparing both a very endemic area and a little lesser, in the area that has a little bit less of CWD in the wild deer. They will be, they're collaring deer, they're looking at predators as well, and they will be examining a lot of different things. They're using volunteer landowners to go on their property and do some of the deer trapping, as well as volunteers of the public for it. And we do try to work with industry. We do attend their professional meetings, we communicate with organizational leaders. There's talk about biosecurity being one of the greatest tools that we have to combat CWD. We've been having conversations of their professional organizations to come up with ideas and standards that they think is good biosecurity practices. And then, of course, the response plan is another cooperation area that we have in Wisconsin.
Lights, please. Gosh, Sean, you got a mic? Is there a mic on there, Sean? Here's the mic.
I just thought you might want to note that petting zoo, or that small herd, that USDA did come in there and do live testing, and the industry helped support that, and it's helping to pay to keep that deer herd alive. We're kind of using it as a research project to see what happens going forward. But there was no more positives on the live testing, but it's a small number as well.
Yeah, it's a small number. There's only, I want to say like, yeah, they're down to 5 now. I think there were 7 deer when they first started. They had some death loss. I don't believe that study is going to be continuing. Dr. Nichols was the one heading that up, and she took a new position. But that was a nice opportunity and nice cooperation between the organizations, the professional organizations, USDA, and the cooperation of the herd owner itself. So, thanks for bringing that up.
Catherine?
I just wanted to mention, or ask, it may be completely coincidental, but in Saskatchewan, Alberta, and in Wisconsin, there were quite a bit stronger programs to reduce the herd densities in the wild. And then after the stopping, or the change in that program, I noticed all 3 have an increase in what you're finding in the farmed animals. And I was just wondering if you could comment on that in terms of the program that Wisconsin had in the wild, the stopping of that, and if that might be changing, that you're starting to see it in the farms without the trace outs, or if it's food related or what that might be due to.
Well, you are right that Wisconsin's initial response, and I'm speaking a little bit for the DNR, which I should not do because I don't have the history there, did initially, in the early days of CWD, really try to take down some of those wild deer populations. It was less than successful. Part of it was the public response to that. There was increased hunting, increased hunter permits given and so forth, but they also brought sharpshooters in, which also met with a lot of public resistance. So that program was short-lived. And yes, we are seeing increased prevalence in that southern part of the state to this day. In fact, in that one area of Dane County, the mature bucks edged towards 40% infection rate in their last testing. We had, but can I relate that to the increase that we're seeing now in our preserves and our few latest positives? I'd be hard pressed to say direct response of that, simply because the area of Wisconsin where those latest positives have come, we have not tested wild deer positive in those areas. So it'd be hard to connect the dots there, but that's a very good observation.
Grant has a question.
I guess one of the things that I was impressed with was when Wisconsin first detected CWD in their wild populations. They did a very good job of sampling all of the counties with the entire state with hundreds of deer, so they had a good sample size to say that it wasn't there. Can you comment then on your confidence in knowing that CWD isn't in the wild populations where you say now that there is the link? Because my understanding is sampling's gone down. If you base it on earlier estimates, you say yes, we've tested extensively, but can you say within the last 3 to 5 years you've tested and can say it's not there?
You hit the nail on the head. And every time I have said that, you'll also notice I have stated that we have not found it in the wild yet. And unfortunately, we had the conversation around the dinner table last night that it is unfortunate for the captive deer industry. I know there's a lot of you are captive deer, and the political ramifications of that testing. I'm getting a little bit off topic, but for instance, this large preserve that just came positive in 2016, I did look up testing data. Initially, you're right, initially there was a fair amount of testing. There's monies, there's federal monies for that. The state kicked in money, and then those have dried up recently. So the testing in the last, since 2006, I believe is when some of that federal funding had dried up, has diminished greatly. The targeted testing that I was talking about has taken precedence over that just because of money, time, and resources. So back to the captive facility in Oconto County there, I looked back at their testing since between 2006, don't quote me 100% on these figures because I'm doing it off the top of my head, but between 2006 and the diagnosis of that positive hunting ranch, there were less than 30 deer tested. So in that almost 10-year span, they had that few deer tested in that area. Now they're picking up testing during hunting season. They, of course, were actually giving away tags in the very close perimeters of that hunting preserve, and they're picking up testing incredibly. Will they find it? Possibly. Whose fault is it going to be then?
One last question or comment.
They probably were testing more animals from that ranch than outside the ranch.
Oh, but by far, yeah, absolutely. And for many years, testing high levels in that ranch.
Okay, I think we'll cut off questions there for now. We have another opportunity for questions a little bit later on with the roundtable discussion. But I'm not sure what everybody else has got, but my stomach is growling. There's a little bit of food out there. So what we will do is we'll take a break for lunch, approximately half an hour, and try to get this back on the road again. I hope everybody's enjoying themselves, and we'll bring it back in half an hour.